The Community Health Leadership Board looks at the social determinants of health in our community and has been gathering data around housing, food insecurity, and St. Joe's has been a leader in our community in tying in food delivery to patients. And as a community, we're collectively looking at that, recognizing that those needs are so important. Someone isn't going to go home and be healthy without food, without a home, without the clinical health care they need also.
Food insecurity is one of those issues in our community that is kind of a silent issue and may not present right away. And that's why it's so important that we focus on individuals that are struggling with food insecurity. And food insecurity can mean so many different things. It can mean that someone doesn't have enough food in their home. They might run out of food before they get paid again, or they might be feeding themselves on food or purchasing food that is not very healthy because they don't have enough money to do so. And it can have such a huge impact on a person, especially if they have a chronic disease. And knowing that, we are very, very careful at St. Joseph's to make sure that we're screening patients that we're taking care of, screening folks as they come into our hospital and asking them about their food security, as well as patients that we care for in our primary care practice. We do that because we know that good nutrition has such an impact on their health. And we don't just screen, it's not just words, but it's also action. We're so fortunate at St. Joe's to have so many wonderful collaborations in our community, especially around food insecurity. Good Shepherd Food Bank has been fantastic. We've been collaborating with them for years to provide shelf-stable food to our folks that are food insecure and struggling. We also have a wonderful partnership with Eastern Area on Aging. They provide frozen meals that we can keep right on site at the hospital to hand off to patients when they're leaving so they can go home and have a warm meal. It always is very amazing to me how comfortable people feel when they do come in to access care and when we're asking them these questions, and how relieved they are that we're asking. Mainers are very, very proud. They are very hardworking. It's very hard for Mainers to ask for help. I know that because I'm from here. So you really have to be mindful about what's going on in your community so you can help to support them. And again, when we're asking patients about their food insecurity, they're grateful that we're asking. So it's not always something that they would feel comfortable asking for help for.